We left off at this one. So, which of the following are predicted to be a growing trend in respiratory care for the future? Is it 1, decreasing use of respiratory therapy protocol? 2, increasing the need for patient assessment skills? 3, increasing involvement in smoking cessation? And 4, clinical decision will increasingly be data-driven. And that's going to be 2, 3, and 4. Who is discovering O2 in 2, 3, and 4 is going to be data-driven. It's not going to be the therapy protocol. It's going to be 2, 3, and 4, increasing need of patient assessment, increased involvement in smoking cessation program, clinical decision will increasingly be data-driven. Who discovered O2 in 1774 and describe its a dephlogisticated air? Is it Joseph Priestley, Thomas Beddoes, Robert Boyle, or Jack Charles? And it's actually Joseph Priestley. Which of the following medication has never been delivered as an aerosol by a respiratory therapist? Is it anticholinergic, mucolytic, antibiotic, or inotropes? Who is credited with first describing the law of partial pressure for a gas mixture? Is it Thomas Young, Joseph Priestley, Jack Charles, or John Dalton? It's actually John Dalton. The majority respiratory care education program in the United States offers what degree? Is it associate degree, bachelor's degree, master's degree, or certificate degree? Associate's degree. Day respiratory care education program in the United States. The United States are accredited by what organization? A day? Why does it even say like that? A day. It's a little weird. Let's see. A day something. What was that thing? It's a mechanical shit. Increase. Nope. This one. Committee. So 22. What was it before? The majority respiratory care education program. Okay. So majority. What is it supposed to say? Today respiratory. Specifically, today respiratory care education program in the United States are accredited by what organization? A committee on accredited for respiratory care cohort, National Board of Respiratory Care, or American Associated Respiratory Care, or Joint Review Committee for Respiratory Care. It's actually cohort. 32. Is the healthcare discipline that specializes in the promotion of optimum cardiopulmonary health? Is it cardiopulmonary pharmacology, nursing, or physician assistant, or respiratory therapy? It's respiratory therapy. When was positive and expiration pressure, PEEP, first introduced to treat patients with acute respiratory distress syndrome? Is it 1967, 1946, 1958, or 1935? When was positive and expiratory pressure, PEEP, first introduced to treat patients with acute respiratory care? 1967? Yeah, 1967. Who was the first to develop the largest scale production of O2 in 1907? Is it David Boyle, Robert Dalton, Carl von Lindt, or Thomas Anderson? Carl von Lindt. Who discovered the X-ray and opened the door for the modern field of radiology? William Röntgen, Thomas Young, or John Dalton, or William Smith? It's actually William Röntgen. Okay. Which of the following was one of the first positive pressure ventilation development? MA1, or Birdmark 7, or Drager pulmotor, or Ingstorm? Is Drager pulmotor. Who introduced the use of soft rubber endotracheal tubes around 1930s? Is it Hyatt, Murphy, McGill, or Davison? And it was McGill. Blank was widely prescribed in hospitals via the 1940s and is still a mainstay of respiratory care. Is it mechanical ventilation, oxygen therapy, aerosol medication, pulmonary function tests? It's actually oxygen therapy. In 1662, a chemist published a book that described the relationship between gas, volume, pressure. What was the chemist's name? Robert Boyle, Anthony von Leeuwenhoek, or Leeuwenhoek, or Nicholas Copernicus, or Sir Isaac Newton. And it's actually Robert Boyle. Who introduced the first laryngoscope in 1913? Jack Emerson, Chevalier Jackson, Thomas Allen, or Forrest Berg? Chevalier Jackson. Blank is one of the primary treatments for asthma: aerosol medication, pulmonary function tests, oxygen therapy, or mechanical ventilation. And it's going to be aerosol medication. Which of the following is an expected role of a respiratory therapist? Is it 1, promoting lung health and wellness, providing patient education, assessing the patient's cardiopulmonary health status, selling oxygen O2 therapy device to patient? And is it only 4 only, or 2, 3, and 4 only, or 1, 2, and 3, or 1 and 3? And so it's going to be actually 1, 2, and 3. Okay, it's going to be promoting health and wellness, providing patient education, assessing the patient's cardiopulmonary status. So promoting health, providing patient education, and assessing patient cardiopulmonary status. Okay, where are the majority of respiratory therapists employed? Diagnostic laboratories, hospitals or acute settings, outpatient physician office, skilled nursing facilities. It's actually hospitals and acute settings. What was the primary duty of the first inhalation therapist? Support O2 therapy, aerosol therapy to patients, maintain patients on mechanical ventilation, or provide airway care? And the answer is support O2 therapy.